Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Scott?
Present.
Commissioner Kinlock?
Present.
Commissioner Anderson? Commissioner Anderson? Commissioner Baker McCormick?
Here.
Chair Colleen?
Present.
You have a quorum.
Thank you, ma'am. What's next?
We're moving on to item B, approval of the June 23rd, 2021 meeting minutes.
Mr. Chair, move approval of meeting minutes with any necessary corrections.
Thank you, Commissioner Kinlock.
Support.
It's been moved and supported. All in favor of approving the previous minutes, please say aye.
Aye.
Aye. Anybody opposed? Okay, Madam Clerk.
We are moving on to item C, Chairman's remarks.
Yeah, just real quickly, Director Jordan is invited here today. I thought it would be good to get a baseline for this committee to talk about what the county is already doing in its budget when it comes to behavioral health in the county. And that may also lead into a discussion of what other kinds of things that we may be looking at as a health department and as a Department on Health, Human and Veteran Services to improve behavioral health efforts by the county. I also am going to leave under such other matters to have a discussion, a little bit of a discussion with the committee at that point. Scheduling these meetings is a little bit of a difficulty. So I want to go over with committee members that we can kind of lock in a once a month meeting and get everyone's agreement on that. And I think we'll also talk about future agendas at that point too, but I'll save that discussion for other matters, item F on the agenda. So Madam Clerk, next.
We are moving past item D, unfinished business, and we are moving
because there is none.
Yep, we're moving to item E1 under new business, discussion with Melita Jordan, Director of Department of Health, Human and Veteran Services, regarding plans to address behavioral health in fiscal year 2021 through 2022.
Thank you, and thank you very much. And that's exactly the discussion I had with Director Jordan to talk about the department's budget for the upcoming year and what in that budget is addressing behavioral health. And we'll start with that and then go into a discussion a little bit in terms of, because there is ARPA dollars out there, and go into a little bit of a discussion about perhaps some other initiatives in addition to what the county is currently doing when it comes to behavioral health. So Director Jordan, I want to thank you very much. I know we kind of put the squeeze on you to be here today, and you responded very nicely that you could be here. So Director Jordan, if you're ready, I'm going to turn this over to you.
Good afternoon, and thank you very much. It is indeed a pleasure to be here. Again, my name is Melita Jordan, and I am the Director for Health, Human and Veteran Services. It is my pleasure to be here today. I would like to thank Chair Commissioner Killeen for extending me the invite. I would also like to acknowledge the Honorable Vice Chair, Commissioner Monique Baker McCormick, Commissioner Anderson, Commissioner Kinlock, and Commissioner Scott, distinguished guests, and the general public. I have been asked today, as recently just said, to describe what activities are being proposed for fiscal year 21-22 that relate to behavioral health. And with that being said, I want to start off by saying, according to the most recent research given, fewer than half of the people diagnosed with behavioral health and or mental health illness or issues do not receive treatment. The unmet need for behavioral health services is greatest among those that are underserved groups, those that are minority and ethnic groups, and those who are low-income persons who are either underinsured or uninsured. 4 out of 10 adults suffer with behavioral health issues as a result of this unprecedented pandemic due to COVID-19. Oftentimes, people are exhibiting signs of high levels of anxiety, increasing feelings of hopelessness, as well as depression, insomnia, and disruptive sleep patterns. So I want to just share a little bit about the current funding that we have. Commissioner Kleen, I know that you just mentioned that the ARPA funds, at this time, I do not have any insight to any or the amount of ARPA funds that may be allocated to behavioral health. So I will share with you what the last 2 years in terms of funding and what I project as being the current funding that has been shared with me in terms of HHVS funding for behavioral health is $9.6 million for fiscal year 21-22. As you know, we received funding from the Detroit-Wayne Integrated Health Network as a source of funding. I believe your last meeting that the executive director, Mr. Eric Doe, spoke at your meeting, and certainly shared a lot of information in terms of the services that they actually provide, and a lot of the work that is currently being done in Detroit as well as in Wayne County. So from our jail health, we received $5.8 million in funding. For juvenile services, $3.8 million is received. And as you know, the DWIN is what the Detroit Wayne Integrated Health Services are fondly called, DWIN. And they have a contract, of course, with the Wayne County Third Circuit Court for child safety, in addition to the Wayne County Department of Health, Human and Veteran Services, which I have oversight for, and the Wayne County Jail Medical Health Services, which I also, as you know, have oversight for. In terms of the third court services, those include predispositional testing and assessments of children that come through the court system, in addition to psychological testing, as well as obtaining a social history on families and children. And they come before the court in order to either prevent and or decrease a young person from either reoffending and or perhaps being incarcerated and or being placed out of their home. Secondly, the Wayne County Department of Health, we coordinate services also. We provide 3 different types of programs. One is our children mental health services, and those particular services are through the Assured Family Services or Choices program, and those young people perhaps may be eligible through Medicaid. Also, an inventory functioning, which is a standardized assessment that's done for young people when they enter the program to determine if there's any concerns or issues that have been raised in terms of their behavior as it relates to school, in the home, or an adjustment in social settings, or potential harm to themselves. Those young people are assessed up to the age of 18. In addition to that, we provide this coordination of services as well. And these programs are in the community, providing access to the community for mental health services or behavioral health services that are for children and youth in the juvenile justice system, and provides rapid and immediate services to that young person that may need an intervention immediately. The program also provides coordination and collaboration between providers, healthcare systems, and again, nonprofit organizations as well that will help young people be able to adjust. And then the third program that we have oversight for, of course, is the Wayne County Jail Mental Health, which is for adults. And again, this particular program provides health services to those inmates upon screening, being assessed, as well as being able to determine if there's an intellectual development disability and or if there's a serious or emotional disturbance that has developed in that individual and that would have I would say, an adverse impact on their day-to-day or their daily living needs while they are being housed in our facility. I would like to say, unfortunately, many of the young people that we have provided or are providing services for, 86% last year in fiscal year 20. I currently do not have fiscal year 21 numbers to date for the last 9 months. Of course, we will definitely have that by the end of September to give an accurate count. But over the last 2 years, not only 19 and 20, 86% of the children that have come through our juvenile detention center have actually met what they consider the serious emotional disturbance protocol or profile. And I find that very concerning that that level, that amount of children who come through our system have had a diagnosis of either a disability, ADHD, and or disruptive behavior, and or schizophrenia, delusional, and or being or have had a diagnosis of psychosis or being psychotic. And so clearly there needs to be more access and venues to receive behavioral health services, not only when they enter and or touch our court systems and or touch the penal system, but also just within our own communities to make access in schools for behavioral assessment, as well as other nonprofit organizations who are doing great work, such as our Big Brothers, Big Sisters programs, a number of the community programs that are available within our communities that children can actually go to, and or when there is an emotional or a violent event that our young people may encounter, that they have the opportunity to have conversation as well as intervention, so that that can not only help them, but also help the families. As you know, when young people live in socially disadvantaged communities and or live in areas where there is a lack of access to behavioral health services and or do not have an opportunity to express their thoughts and their feelings, oftentimes young people will feel, one, that they're stigmatized, and or we still in this country tend to have a stigma around mental health. Mental health and behavioral health, as well as physical health, is very important to one's social growth as well as their development. And recognizing that, having a plethora of programs as well as a plethora of avenues for people to receive services is critical in terms of being able to reach the number of children that we come in contact with on a daily basis within our system. So you wanted to know some of the things that we are looking to do. One is to expand and to initiate additional partnerships with organizations. As I mentioned earlier, Big Brothers, Big Sisters, Girl Scouts is another, the Black Family Development, other alternate systems, instead of, again, looking to our juvenile justice systems to be able then to not only interact and assess, but then to treat. And working with a number of advocacy groups, internally and externally. would benefit not only the residents of the county, but more importantly, the families within this county. So supporting evidence-based programs and interventions that support mental and physical health for children, youth, and adults is critical to improving not only our families, our children in the future, but also in our neighborhoods. Another area of concern and implementation that I think that we will be, not I think that I will be implementing, is also to address the issue of women who are childbearing and are pregnant and or postpartum. I recently learned that through our women or our special supplemental nutrition program for women, infants, and children, which is fondly called WIC, we do not perform what I call a Likert score and or an opportunity to do an assessment when a woman brings the baby in for their 4 or 6 week checkup. This is an opportune time that we can actually assess a woman who just gave birth in terms of being able to assess if there is any issues that she may be experiencing due to the birth of the baby. But more importantly, recognizing that we all have been in a state of anxiety since COVID hit this country, which again is unprecedented. And therefore research has been done most recently at the Yale School and also at Harvard in terms of a recent study that was conducted showing that women who have reported an elevated period of depression along with being anxious, increased levels of stress at the beginning of the pandemic as well as during the pandemic. So therefore, again, recognizing that we have an opportunity to be able to provide assistance and technical assistance, as well as addressing and referring our mothers and our postpartum women immediately for an assessment if necessary. And so at a pediatrician's office, at our federally qualified health center, as well as our, like I said, is at our WIC offices that we are able to refer our clients so that they can get the necessary care that they need during this very vulnerable and time, not only because of COVID, but also, like I said, in being able to address a newborn baby, which brings its own stress for a mother to be able to adapt to that. And so I'm looking forward to not only working with this group, but also working with other commissioners as well. As you know, our chair, Commissioner Bell, was recently appointed to the governor's task force on juvenile justice. And there's other prominent leaders in the county as well that's participating in this. It is a great opportunity for us to be able to move forward with a lot of the new programs as well. I remember last week that Judge Kenny and spoke, I think it was also, I don't want to, Judge Burton, I want to say. Thank you. And Judge Burton spoke very eloquently last week with such passion about the work that they're doing, in addition to what they have visited, of course, in Miami. There are other programs in the country as well that's doing great work in addition to that, that certainly we can learn lessons from and perhaps be able to implement here in Wayne County. Sometimes it is difficult always to replicate another program exactly as it was done someplace else. But certainly there is lessons to be learned that could be gleaned from these evidence-based programs to address behavioral health issues in our county. So I'm looking forward to doing that. I will also say that this administration is very supportive to move forward, to be able to address the issues. They are well aware of the many issues that we face. I would think one of my major concerns and challenges is to be an advocate for our young people, to change these policies that we currently may have that adversely affect our youth. And so since I've been here a little bit now, almost 4 months now, I will say, I've had the opportunity to look at some of the policies. When I think about the young people that's in our juvenile residential space, and recognize that the time that they are there, some of them perhaps may need treatment, not necessarily, the site has not necessarily been set up for the type of treatment that's probably actually necessary for our young people to receive on a regular basis. But I will say that the time that they spent need to be counted for the time that they're there. And oftentimes a number of our children are there much longer in terms of waiting to be placed and or waiting to be discharged. And that time does not count once they are eventually before the courts. And so I do think there are some things that we can be certainly looking at to be able to address that will impact our children and to mitigate those barriers that they currently are facing. Because the more barriers or less protective factors that our children have, it has a long-standing impact on them as they grow into adulthood. And what we want to do is to have healthy adults to be able to be functioning within our society. I'm going to stop there and I'll allow you to ask questions if you'd like. But I am very excited about what I believe that we can move forward with addressing our children and giving them an opportunity to be assimilated into the community and to be productive citizens within our community.
Thank you very much, Director Jordan, for that report. I will note for the record that just a minute or two after we took a roll call, Commissioner Anderson has joined us. Thank you, Commissioner. And I guess I'll start that way, Director Jordan. See what kind of comments, questions committee members have at this point. And I'll
Mr.
see.
Chair, I have none at this time. None for me.
Okay. Commissioner Baker McCormick, do you have anything right now?
I do not.
All right. Commissioner Scott, do you have anything right now? Yeah, you're on mute, Commissioner Scott. Yeah,
I'm sorry.
the old mute thing. Yeah.
Yes. Thank you. Well, I just want to say that I think everything that she talked about is so relevant for today. So I am just hoping that we can do all of those things, especially getting children some help and stuff with these other organizations. And also with the pregnant mothers and that. So I'm looking forward to hearing about all of that. Thank you.
Great. I will certainly keep you apprised as we develop new as well as expand our relationships, like as I mentioned, with external partners, along with our internal partners to make a difference for our children here.
Yes.
Thank
you, Commissioner. Commissioner Anderson, do you have anything at this point?
Just really quickly, Mrs. Jordan, I appreciate what it certainly seems like you've got your arms around the problem and the problems that we face, especially with the youth, and the excuse me.
For sure.
The young people in the county and addressing the issues that they are facing. I just wondered if there's a long-range, long-term plan that's being put together to try to address those problems, as I know they have so many facets in what they're bringing into whether it's in the juvenile detention center or whether it's those that fortunately haven't been put into that system. But it's something that I hear about every day locally, as well as on the county commission, that I just, it's very sad. And I think that one of the things that I think seems to be missing is the first step people need to take and getting that word out to mothers and dads and relatives, grandmas and grandpas in a lot of cases that are raising their grandchildren, that maybe they have a son or daughter or both that are you know, into the drug, their addiction issues that they have themselves, and the children are not being cared for, but the problems that come from that, the ignoring their kids. I think we have to do better, and I know from everything I've learned from you so far, you certainly have the heart for it. It's whether or not we're going to be able to put together a program to, like I said, give them some direction when folks are struggling to find out who can they turn to. And I'd be interested in hearing what you would be able to say and what your plans are in that respect.
Sure, Commissioner Anderson, thank you very much for that. So let me first off say that to date, I have not developed a strategic plan for it. I will tell you that I will. I have been faced with many other plans that I had to immediately tackle upon my arrival here, which has taken up a great deal of my time. And so this is one, though, that I will tell you that I am very interested in also tackling as well. I have visited the Juvenile Justice Center or the residents on a few occasions now. I was actually there last week. I spoke to the staff there as well. And you're absolutely right in terms of how do we change, how do we pivot to a new opportunity to uplift our children. So one of the things I would first ask each of you, I'd be more than happy, along with, as I bring on a few key people to work with me, but I would also ask you, as Commissioner Killeen has done, is to invite me to your town meetings. Invite me to the areas that you are. I am more than willing to do what I call a listening tour, so that I can come out to the communities and learn and to meet with your constituents and to be able to talk and share with them. In addition to working with those in government as it relates to developing opportunities for our children. Recreational opportunities will be something that definitely our young people need. I was so amazed about our young lady that's in, and I want to say it was in Romulus, that we have an Olympic, we had an Olympic star. And so that was so exciting. And so we are trying to reach out to her. I've asked communications to reach out to her because I think this would be a great opportunity for our young people to be able to hear her and to talk to her, because she's come from their neighborhood and she looks like them. And I think the number of Black and brown children that we have in our juvenile detention residential services need to see how she has succeeded in a community in which they have grown up in as well. When I went over to the residential facility as well, I saw the beautiful artwork that these young people have done. I can't draw a straight line. And when I saw the wonderful murals these young people have put together of all backgrounds and ethnicities, I was so amazed. I took pictures of it. And so if we can showcase the work that our children are doing and to encourage them and to inspire them and to share our stories, because a lot of us, we had some tough times too growing up, but we succeeded. And I think that when we share our stories, and they may think we're a little old Tommy, but there's nothing new under the sun. Is that right?
Exactly.
So I know that what we would say to them in such a way that would resonate with them, they will remember it. They may not tell us at that moment, but I know they will remember it. And so I think that we have an opportunity to provide not only jobs. I believe that we have an opportunity to invite them in to participate on task force and committees that we have to give us input so that we can hear their voice. And I know things are a little different now, but I do believe that we have an opportunity to inspire our children to do better. And we can inspire the parents likewise. So I'm looking forward to working with all of you to develop a strategic plan and put together evidence-based interventions to address those children who are vulnerable to crime, to dropping out of school, to becoming pregnant early prior to them reaching an age of maturity, so to speak, so that we can be able to, like I said earlier, is to have young people that grow up and be healthy and be a contributing member to society and not a burden to society.
Thank you.
Thank you.
Anything else, Commissioner Anderson?
That's all I have for now. Thank you.
Thank you. Thank you, everyone. And Director Jordan, I'm going to, for my discussion here, I'm referring to a document that's on the National Association of Counties, NACO's website.
Yes.
Which is an overview for America's counties, the U.S. Treasury's interim final rule and guidance for state and local ARPA fiscal recovery funds.
Mm-hmm.
And they lay out what's in the law for what is permissible to be used. And of course, one of the areas is, one of the general areas is to support the public health response. For mitigation efforts, medical expenses, behavioral health care, and certain county public health. So supporting public health going into the future is part of the idea behind the ARPA dollars, American Recovery Plan. When you go into public health, a subcategory is improving the design and execution of health and public health programs, and this is one of the things you have just discussed. Another area is address disparities in public health outcomes, and under that they say, in recognition of the disproportionate impacts of the pandemic on health income of low income and Native American communities, the importance of mitigating these effects. The interim final rule identifies a broader range of services and programs that will be presumed to be responding to the public health emergency when it comes to when provided in these communities. And even more specifically, they say services like could include things like community health workers, when we're talking about outreach, public benefits navigators to help people understand what's available, and in general, childhood health and welfare. So what I'm very much interested in exploring with you is, I think, you know, it's a big target that we have here, a huge one. And there's not enough ARPA dollars to take care of it all. And the county's going to have so many needs for its ARPA dollars. So I'm not making a pitch here like, you know, we need $100 million to do this. We've got, you know, a lot of other, but what I am encouraging is that some of the ARPA dollars go to the more long-term response, which definitely is part of the American Recovery Plan, so that down the road we have a stronger health department and a stronger community with regards to health and behavioral health. And I agree with you, it has to be more than just the justice system. A lot of our stuff is around the justice system right now, but there is a greater need in the community for that. And we have to deal with the social determinants of health and the disparities. So all of that being said, and I will say, you're the expert. I'm just kind of an elected guy, and with a big interest in this area.
Sure.
But I think with limited dollars, I think having this dialogue, and I'm going to lean on you and your department as an expert for paring down maybe some money to go to something wouldn't be necessarily a good idea because we can't execute it, or is this something that we can make a permanent change that doesn't need, year after year funding that may not be possible for us to do. So I'll be relying on your expertise for where these dollars can be used surgically to move the ball forward and that we're left with a stronger health department. What's your reaction to that kind of approach? Or
Sure. So let me address that. So I will say, as I mentioned earlier, I'm not sure the outlay of the ARPA dollars at this point in terms of where those dollars will be allocated.
Right. None of that is in the budget for the coming year yet.
That's correct, to my knowledge. So I will tell you, however, one of my focus will be to broaden our portfolio. I think it's important that we learn to leverage our dollars as well as broaden where we get our monies from. And so most of our dollars have come from the state in terms of providing certain programs. I think one of the things that you've noticed when each of you received my resume was the fact that I too am a grant writer. And I have most recently brought on another person who's also a grant writer. So I do think it's important that we write for federal grants, as well as reach out to foundations to help us do the work that we would like to do that normally is categorized when we receive money from the state, meaning that it's specific about what you can do and what you can't do. And
Right.
So therefore we need a broader portfolio that we're able to do some of the programs that you're talking about without being dependent upon, is it going to come from the state and or do we have the money, of course, in the general fund? As you well know, there's tremendous needs in the county. And so my thought was that, first of all, I have someone that's looking at the federal registry on a daily basis to let us know and let me know where there is grant opportunities that will fit into the portfolio of the work that we're trying to do here. So that's one thing that I am moving towards looking at and would be able to support. And of course, those ideas would come before you as well. And hopefully, if we are successful, I will tell you, we currently have a grant that will be coming before you that was actually written prior to me getting here. However, I've made some modifications to it. So we're working with 15 partners. It's a $4 million grant that will provide exactly what you just mentioned. We will be able to hire some community health workers. We will be able to provide navigators. And so this is all through a grant that will be for until 2023. So $2 million a year that we will receive to be able to put into the communities to not only improve healthcare services, but also to address health literacy, because as you well know, there is a high dropout rate here in Wayne County and in Michigan. So undereducation leads to other negative impacts on a family. So it is very important that we increase literacy rates here in our communities. I do think that all of the social determinants of health, when we think about housing, when we think of poverty, we think about bad neighborhoods, we think of poor housing areas, stress, family support. We need to be able to have funding that we can help support families. And as I said earlier, more access to those kinds of services within our communities that's needed. And so I think that's an opportunity for us to work with our businesses, with our philanthropy groups in order to support the work that you're talking about. And so I do see in writing a plan that will address social determinants and hopefully add more positive factors in a child's life versus building up more negative factors in their life. And that is one way to combat that. So I do think, as I said, broadening our portfolio is a big piece to this in terms of bringing in additional dollars into the county. And hopefully the commission will support that.
Well, and I like the idea that this grant that's coming, you have the partnerships with, because, you know, I think we're already working with DeWin, but primarily that's around the jail. But I think there's other opportunities there, other collaborations, along with Authority Health.
Yes, that's one of them.
Yeah, there's two big, very large public organizations here in the county, not to mention all of the nonprofits that you've been talking about, you know, from Black Family to Vista Maria, and, you know, so many. So I think the more we can collaborate, if I may be so bold to suggest, you know, we have an absolute hero from Michigan in the United States Senate on mental and behavioral health issues, Senator Stabenow, who's written some very important legislation in this area. And she is absolutely dedicated to the fulfillment of John Kennedy's Mental Health Act, going way back. And she's felt that some of that is neglected. So I think if it's possible, well, it is possible, to find the right staff person over there to work with, to make your intentions and desires for the federal government. You may have perhaps a real partner there that can either help you find stuff or help champion stuff once we have found it. So I would strongly suggest developing a relationship with Senator Stabenow's office, particularly in this area.
Thank you. I'll make sure that I can have Andrew make the connection for me. Thank you so much.
Yeah, this is, Debbie's been an absolute dream on these issues that too often go neglected. So I think at this point, you know, it's the strategic plan to come. And hopefully at this meeting, we can have a few conversations about that as it's being developed.
Sure.
And I have gotten nothing but the sense, as I talk to my fellow commissioners about this and talking with administration, yourself and other people in administration, that we are absolutely walking in lockstep in terms of improving our public health structure out there for our citizens all over the county. And also,
well, I've had a chance. Oh, I'm sorry.
No,
I was
no,
going to
go
say,
ahead.
I've had a chance to meet with a number of groups so far since I've been here, and will continue to do so. So we are working with Access. We have reached out to the various groups within our Asian community, as well as in our Arab community. And so we're just trying to broaden our reach so that we can learn and be able to fill gaps in terms of what their needs are. And so therefore, once we can get a handle on that and partner with each other, and like I said, leverage the resources that we have, I believe that we can make a difference in families. And so I will be attending their meetings, and hopefully, again, as we put together our own meetings, that we can do something. I did offer to DWIN as well, that if we could partner together by doing a large symposium, perhaps once a year within the county, I think that would be a great idea for us to work together to address a number of the needs. As you well know, we have within the communities, we need to be able not only to address the behavioral health needs, but we also must address those underlying chronic diseases that impact individuals with with mental health issues as well. So those are key in terms of giving a person a not only longevity, but also a healthy lifestyle. So we must address all components. The mind is not separated from the body, as you well know. So we must be able to look at this from the perspective of that physical health as well as mental health go hand in hand.
Yeah, that's why we're in the integrated health era now. And I would also, you ran down a bunch of good things that we're doing in the county currently, with great hopes for things to come. But as you know, quite often, public is a little unaware of what we do. And so I'm also looking to step up our game in terms of making the public aware of county government. I think quite often, and county government here flies below the radar quite often, with Detroit politics dominating, and then state of Michigan politics. If you're a county commissioner in a rural county up north where you're plowing the roads, and it's a much higher profile because it's the commission that runs everything here. So I would just look for ways of getting the word out that can be, and especially in the social media environment, to kind of have a background, what I call background radiation out there, where people are hearing, people are seeing what the county is doing, what kind of programs we have. When we add something new, like when this grant comes through the commission and we get that all said and done, we should be telling the citizens of Wayne County that we have added this. So I think anything that we can do through websites, through social media, that commissioners can participate in and help get the word out. I think we need to be more of a bullhorn. Wayne County government does a lot of good things, and not enough people are aware that we do.
You're right. You're right. And so I will say, in my first 90 days since I've been here, one of the things that I have expanded, and it will be rolling out soon, is a dashboard. Now, the dashboard will be updated on what we call real time, so that you will be able to get those COVID numbers as well as those underlying risk factors that I just talked about. It is extremely important that we understand that, again, alcohol usage, tobacco usage, all those are underlying risk factors to chronic diseases such as cancer, to lung disease, in terms of hypertension and diabetes. And so my goal is to make sure that we have a dashboard that anyone can take a look at on the website and be able to get updated information in terms of what our COVID rates are, what exposure is, what the prevalence is, positivity rate. So the staff is working on that as we speak. And I hope that we will have that out no later than mid-September, but I will certainly let you know that. In addition to that, we certainly can begin to write more. We can write op-eds. We can update our website a little bit more frequently with updated information. So we will be working with the communications department in doing that. We can put together, one of the things I've asked for, and I'll speak about this a little bit tomorrow in the budget address that I plan to give, is in terms of bringing on a few more epidemiologists, because it is important that we're able to develop fact sheets. And I think that your constituents would appreciate to see fact sheets, because if they can see the fact sheets in terms of, is when I mentioned earlier, 4 out of 10 people may have a mental health issue and or behavioral health issue, and yet they are not receiving treatment. So the issue is, we should be able to develop data sheets that speaks to behavioral health. We can develop data sheets, and we can get data, of course, from DWIN, as well as get data from other sites. We have what we call a behavioral risk factors. So we can be able to look at self-reporting data as well, in addition to actual scientific data. So fact sheets can be developed, but my EPI people would be able to do that, and to do that on a regular basis. And so those are the types of things that I am trying to initiate, but I do need to make sure I have not only myself, we will be doing some geospatial mapping. So instead of us always doing PowerPoint, we'll be able to really be able to speak to presentations by showing you specific in your zip code or your neighborhood or your census tract, to be able to give you real-time information in terms of data that you're probably very much interested in knowing.
Yeah, and
It'll take me a little bit more time, but we've
Yeah, yeah.
already started the process.
it's a big job. We're getting down the road. But I'll also comment at this time, the Delta variant, as you know, Director Jordan, I'm a biologist by training. I understand basic viral biology. I'm not a epidemiologist or anything, but everybody could see the variants coming. That's just the way this goes. And I know we haven't talked about this a whole lot, but we're about to have a wave wash over us here. It's just, half of Wayne County, 2/3 of the city of Detroit are basically unprotected against the Delta. We've gone from 5 or 6 cases a day in the state of Michigan 4 or 5 weeks ago to now we're doing 1,000 cases a day. Florida's doing 22, 23, 24,000. And that shows no sign of slowing down there. And I mention this because there is that, as you suggest, just among the general population, the mental health issues over weariness and tiredness of how people have had to change their behaviors. And now we have this idea, or have had it for a month or so. Hey, everybody go out and party. Everything's cool. And now we're going to have this wave wash over us again. And we're going to overwhelm our hospitals. We're going to have more businesses that are going to close. And so I see the mental health issues that people are having are going to get nothing but greater as we go, because the end is not in sight for us when it comes to the variants. And heaven forbid, there's more variants to come. Yeah. When over half of the world doesn't have even one shot, that's a whole big soup that's cooking out there, and more variants are going to emerge. And heaven forbid we have one where we have to reconsider the Pfizer, the Moderna, and the J&J that may not be as effective or as effective at all if we have to develop a new one. So I'm just looking the long term there too, that this is not past us. We're still in the middle of it, and COVID is still teaching. We're still learning. We're not on top of it yet. Just listen to any doctor that goes on local TV that talks about what's going on in their hospitals and what's happening. Again, I want to thank you. Let me check one more time with my colleagues for any additional comments that we have. Was that Commissioner Anderson, was that a signal that you need to be recognized? Yeah, you're on mute, dude. Uh-oh. You're good, sir? Okay. Commissioner Scott, anything additional?
No, thanks. I see we got a lot to do.
Yeah, we do.
And we've got a great director heading it, so
Well,
I am pleased.
Thank you very much.
That gives us a great leg up, Commissioner Scott, that we have someone attacking these issues in the decision-making seat. Commissioner Baker McCormick, anything else?
I thought I saw that she had dropped off, but
Yeah, I think we might have lost Commissioner Baker McCormick.
Yeah, she has some kind
Some
of
people are
issues.
losing. I almost lost my lights. It twinkled.
No,
Yeah.
that's what I'm saying.
I've
That's
got
it.
a storm.
Yeah.
Yes, quickly. So dark. Yep.
Yeah.
Yeah.
Commissioner
lost power.
Kinlock, you accurately pointed that out in your note. It's nighttime downtown right now.
Yes.
Anything else, Commissioner Kinlock, at this point?
No, it's just she covered a lot of areas. The areas that we as a community need to really focus on. And so, I mean, I'm just very impressed with all the information and the roles and what her department, her team are tackling.
Yeah, and now the trick is to turn it into an action plan, which we're working on too. Director Jordan, you had something to say on that?
Well, again, as I begin to move from one area to the next area, I am, like I said, spending time writing. As I visit the sites, I take copious notes, and I will be able to put together, I like to work in what I call a logic model. So I like to put logic models together, which actually is a part of an action plan that will show you what resources we need, again, what activities we are planning, and then what action needs to be taken, and then how long it will take to achieve those things. And so I tend to work in a framework like that. And so does my staff, teaching them to do the same thing. So I will be able to come back at some point to share with you where we are and how we're rolling out these programs. And hopefully, as I mentioned, as we are able to secure more money, is to be able to stay aligned with what the commissioners are interested in happening within their communities, and to, again, build upon the foundation that's already been started prior to me coming.
Okay. And while you're still here, Director Jordan, because we talked about this just a little bit, a few days ago in a separate email to all of the members of this committee, you got a report from the Robert Wood Johnson Foundation with regards to the health rankings of all 83 counties in Michigan. That's a report that comes out annually.
Yes.
Annually, Wayne County ranks 83rd out of 83. But I want to point out here, as Director Jordan might, that that's a little bit misleading, and it's not besmirching our public health department at all. Those numbers also include the city of Detroit, which has a lot of issues with the poverty, and they're outside the reach of our health department generally. But it does give you a good background when you look at what they are ranking and the kinds of things they're looking at when they do the rankings. I think that report will give folks a good idea of where we need to be strengthening things, because public health needs to be much higher up the agenda than it is. So please check out that report. I do have hard copies in my office here for people, but just to start or continuing to get your head around issues, and I'm speaking to my colleagues here, of public health and what we're facing, that report, that annual report, is very helpful. A lot to do, but when you get into the social determinants of health and those issues, when you have high poverty, you're going to have a lot of these issues. So again, it's nothing to do with our health department. It's more the community that we're working within and how we can make progress. So please read the report in light of that. Dr. Jordan, or Director Jordan, thank you so much for being here today, and look forward to our next discussion.
Thank you. Thank you. I look forward to seeing all of you again tomorrow morning.
Yeah, there you go. Yep. We are going to move the agenda, and if you want to hang out, Director Jordan, that's fine, to the other Madam Clerk, if we can move the agenda.
We're moving to item F, such other matters as may be properly submitted before the committee.
Yeah, and here, as I suggested at the beginning of the meeting, two things. This has been difficult to schedule this meeting, so I wanted to see if there was a way, or if this was a fine time as a special committee. We don't meet every other week as our standing committees do. My intention is to have once a month meetings and to find a time slot that everyone is good for. For this meeting, well, we tried it on a different day last time, and we have one of our committee members who's absolutely committed to another meeting at that day and time. So I went to this time and date.
This one seemed to work. This one, I have anything. This was one of the clearest days I had.
Is this a good time?
Yep, this time. Yep.
Okay, Commissioner Scott, can you, is this a fine time to have this meeting for you too?
It is.
She says excitedly.
I know, you're right. Hold
Yeah,
on.
I know.
No, it is. I don't know that, well, maybe 3 o'clock, but mine is at 1 o'clock and
Yeah. Well, see, and I wanted to, you know, we talked about 2:30 at one point, because I didn't want to step all over your meeting, you know. And so we just wound up at this 3 o'clock, maybe 2:30 following your meeting, but your meeting was canceled today, right?
right.
Yeah. But maybe we go 2:30 perhaps on this day.
Yeah, that's even a little better.
Yeah, Commissioner Anderson, I know that first time we had gave you some heartaches. What about this time, Commissioner?
Wednesdays are not good for me. So it's, I guess you have to take a consensus and run with it. But I may just ask me to excuse from the committee.
Okay, yeah, because see, we're hemmed in by all of the other committees and the staff time we have on commission staff to do this, and didn't want to get outside of the Tuesday, Wednesday for committee meetings. Didn't want to look necessarily at a Thursday or a Friday. So we'll work with it as best we can. Commissioner Kinlock, you have something?
Just one quick thing I was going to
Yeah,
ask.
Commissioner Anderson.
Is there not a possibility of having it immediately following, as my CJC meeting is, immediately after the full commission meeting on the ones that I don't already meet? I mean, it leaves you 3, I believe it leaves you 3 to choose from. 3 Thursday.
One more time, Commissioner Anderson.
Okay.
When's your meeting?
It's the always after the last full board meeting of the month.
Okay. So you're suggesting noon? No, later than that. 1, 2 o'clock on the second full board meeting on a Thursday?
I have mine scheduled at noon.
Okay. I'll send around an email to everybody then. Give people this time, give people the time that you're suggesting, maybe 1 o'clock after full board, the second full board of the month. I'm pretty agnostic. I just want everybody to be able to attend. So when it is, I'm not.
If she sent that email around so I can look at the schedule, can you?
Yeah.
D-Wing.
Yeah, that's why I'll do it with an email rather than trying to do it verbally here, so everybody can look at their schedule. Commissioner Baker McCormick, do you have anything on the scheduling of this meeting? We're kind of talking 2 times the one we have right now and possibly that Thursday after the second board. Oh, that's right. We don't have her, do we? All right.
That's why the email gonna help, right?
Yeah, well, I think she's voting aye then. I think she's going with it. Okay, and then, so we'll send an email. And then also from my colleagues here, and we can do this by email too, but I want to see what kind of things people want on this agenda. What kind of things are we looking for? You know, do we want somebody from the federal government to come over here, talk about issues there, somebody from the state, something locally here, a nonprofit that's doing great work around the county? Do committee members have other ideas about what should be on this agenda? Commissioner Anderson?
It's not to that. I was trying to get back to the, just a correction. The CJC meets on the 2nd, after the second full board meeting. So it would be
right,
probably the 1st.
Oh, I see. To place it in there in place of your meeting.
Mine are the second full board meeting of the month.
So that noon or 1 o'clock after the first board meeting of the month.
Correct. Thank you.
Okay, I got it. I got it. Anything for future agendas? And of course, we can do a little of that on email too. But I don't want to, there's a lot of folks on this committee with a lot of knowledge. And although Baker McCormick is not here right now, you know, she's chairing Health and Human Services. So I don't want to just make up the agenda each time. I'm looking for input from committee members as to the kinds of things that we should be taking up here. Commissioner Kinlock?
No, I think some of the things that we've went over today, you know, is absolutely something that we want to just receive a lot of reports and then keep our eye open as it relates to various mental health and physical health and issues that we think that we need to dive in on. So I think that we covered a lot of areas that we're going to be getting regular updates on, and then we can, I guess, drill down based upon the, you know, the data that we receive.
Gotcha. Okay, I'll mention one other thing here, and I'll send it around on email too. And I don't know if you remember off the top of your head, Commissioner Kinlock, but based on our last meeting of this special committee, the legislation in Lansing to hand over the Medicaid dollars to health plans, for-profit health plans, to run mental health in this state instead of the public system that we currently have, including DeWin. Coming up, and I forget the date on it now, and DeWin is also sponsoring this. We're going to have the lead Republican in the Michigan Senate out for a public meeting. I want to say, do you remember, Commissioner Kinlock? Is it, I think it's the middle of September.
Yeah, I think it's sometime. I know it's sometime in September because I don't recall the exact date.
Yeah.
And I'm looking through my email now. I don't see anything
And
I got from Lillian.
And I've signed up. It's planned for an in-person event that they're going to have, but maybe by that time, middle of September, when we're awash in the Delta variant, that may change. But I think it would be very good to hear right from the horse's mouth exactly this legislation and what it intends on doing. So I think it'd be a very important event that people need to have their voice at because this is moving. And I have no idea right now where the governor is on this legislation or where the director of MDHHS is on this legislation, but there seems to be momentum. This seems to be over the 6 or 7 years that this has been put forward. There seems to be bound and determined to get this through the House and Senate this year. And in my estimation, it's a real threat to the mental health system. The public, well, to the mental health system. The public does it better than the private. So anything that threatens that's big. So I'll get that information around to people too.
Yes.
Anybody else?
Yeah, that's important.
Yeah, it is. Anybody else have anything for some such other matters they want to mention? Hearing none. Madam Clerk, do we have anything on public comment? Any emails?
I did not receive any emails.
Well, that means we don't have any then. Is there any member of the public on the phone that has public comment? Just unmute yourself. Any member of the public that would like to have public comment before the special committee? Give you 3 minutes to have your say. Any member of the public, just unmute yourself if you would like to have public comment and make yourself known. Hearing none, I can read agenda item H. Do I have a motion?
So moved, Mr. Chair.
Thank you, Commissioner Scott. It's been moved and supported to adjourn. All in favor, say aye.
Aye.
Thank everybody so much, and we'll
Yeah,
see you
good
soon.
meeting. Thank
Yep.
you.
Was. Thank you.